everybody. I'm Dr. Rachel Buehner, and Dr. Eric Russ is with us. Dr. Russ is the Executive Director of the Kentucky Psychological Association and the Kentucky Psychological Foundation. And we are very, very pleased and lucky to have Dr. Megan Bracconier-Krupa. Man, I went out of my way to say that right, and then I screwed it up nonetheless. So, uh, Dr. BK, as she's okay with being called, is joining us today, and Eric is going to introduce her and tell you a little bit about why we're here, and then we'll get to the good stuff.
Yeah, thanks everybody for being here. I'm really excited about this. I love these webinars. As Rachel said, I'm the executive director of the Kentucky Psychological Foundation and Association. Our focus here is really to bring trusted mental health information to the public. We're so happy to bring you this webinar series along with our partners, Mental Health America of Kentucky and Families for Effective Autism Treatment. We all work together to provide this webinar series focused on bringing experts together to provide education awareness resources to families on the autism journey. I'll put some links to all of those organizations in the chat shortly so you can check out more of what we're all doing, working to make Kentucky a more mentally healthy state. We'd also love to hear from you all about what other topics you want to hear from, either our general mental health topics, ideas, you can share those in the chat. For our Families for Effective Autism Treatment folks joining us today, if you have ideas for additional webinar topics specific to autism, please let us know. This is sort of a subset of the bigger series that we do, and we really appreciate those suggestions. That's where most of our speakers come from, is from suggestions that you all bring to us. So thank you all for joining today. We're excited to bring together leaders to provide you with helpful information. What you hear today is meant to help you understand and work with some of the concerns around autism. It's not meant to be medical advice, but be sure to stick around until the end to hear resources to consider if your child's issues need further clinical attention. There are specialists who can help, and we're happy to help work with referrals and get you connected to the folks in the state that we need to get you connected to. So I'm really excited about our panelists today. Dr. Megan Bracconier-Krupa is a pediatric neuropsychologist at Glastonbury Pediatric Neuropsychology in Connecticut. She's been involved in clinical research studies examining evidence-based interventions for youth with autism spectrum disorders, as well as adjustment in siblings of children for ASD. Dr. BK completed her predoctoral internship at Clifford Beers Community Care Center in New Haven and postdoctoral fellowship at Glastonbury Pediatric Neuropsychology. She currently focuses on the assessment and treatment of young children with a range of neurodevelopmental disabilities and disorders and their families. Dr. Rachel Buehner is the incoming president of the Kentucky Psychological Foundation and former president of the Kentucky Psychological Association. She serves on the board of directors for Families for Effective Autism Treatment, as well as Home of the Innocents here in Louisville, Kentucky. Dr. Buehner is the owner of Bright Light Evaluation Services in Louisville, Kentucky, providing assessment and ongoing treatment for children, adolescents, and adults on the autism and ADHD journeys. All right, we're ready to dive into our topic today. So, parents and families are here today and will be watching this video whenever they're watching this video. Maybe some of you are sitting up late at night trying to get some info about your families. But everybody wants to do a good job by all their children. Dr. BK, when families hear supporting siblings, what do you wish parents understood right away about how siblings might be experiencing life in autism families?
Absolutely. I'm, glad to kick things off here and talk about the lived experiences of supporting siblings. And I think it's really important when we're talking about the experiences to say that a lot of the challenges in the sibling relationship that we're going to talk about are things that are common in all sibling relationships, right? So this is something that anybody with multiple kids at home is going to experience a lot of this with their kids. But there's a lot of unique obstacles or stressors that we can anticipate and we can set kids up well to be able to cope with and help to support them. And, together with that is I also want to make sure that I highlight that there have been found to be a lot of positives in the relationship when one child has ASD and one child does not. And this is both, anecdotal in kind of your individual experiences with your family, as well as across research. A lot of times results have been found to be, a lot of unique positives together with a lot of the unique negatives. And, specifically diving into some of the positives first, which are a lot of pieces that I'll come back to, is that relationships between a sibling with and without ASD have often been found to include sometimes less of the stressors that you would see between two typically developing siblings. So you'll see less overt sibling conflict or less overt sibling competition in a way that you might see it in other relationships. Consistently, siblings of children with ASD report greater pride for their sibling, greater admiration for their sibling, and really have this appreciation for how unique their sibling is, how they overcome obstacles and process information differently and think about the world differently. And they often report that they, enjoy bonding with their sibling and anticipate long-lasting, close relationships with their siblings, the way you would see in a lot of sibling relationships.
Mhm.
One important piece that I'm going to come back to a couple of times today through our conversation is that siblings tend to be more positive in their assessment of the sibling relationship than parents do. And by that, I mean, if you ask a sibling to rate their relationship with their sibling with ASD, a lot of times they'll be more positive than if you ask the parent to rate the relationship between the two children. And so there's, a lot more positive going on for the sibling a lot of times than there is negative. And I think while that is true, and it's really important for me to communicate to parents for them to kind of understand that there is so much good in the relationship, there's also a lot of really unique obstacles and stressors to having a sibling with ASD that we can kind of set them up well to deal with. And, just the nature of having a social disability, it tends to be accompanied by increased levels of responsibility within the family and differences in the dynamic. And so we see this risk of what's called parentification, or the sibling taking on it more of a caregiver role, which is associated with more pressure to feel like you're a role model or a social example for your sibling. And while there have been found to be some benefits of parentification, like increased resilience to adversity or understanding of family values, there's certainly some negatives that we want to make sure that we get ahead of and watch out for, like limitations or impacts on that child's social life, increased internalizing symptoms because maybe there's less expression of how they're feeling, or feeling like they can't communicate that as well. And consistent with what we might expect in some kids with ASD, there's some evidence of less pro-social behavior or social initiation in a sibling dynamic, or less willingness to engage in shared activities or non-preferred activities in a way that might lead to the sibling feeling maybe less seen or less valued. And there's so many kind of differences that we can see in the sibling relationship. And one factor that impacts that is the severity of the behaviors between siblings, which, can cause increased or decreased challenges. But, overall, when we're talking about the sibling experience, we want to make sure that we're capturing this unique set of positive and negative experiences that we're understanding more and more over time with research, and can help to support siblings in a really targeted way.
I appreciate that. That's great sort of table setting for where we're heading. Dr. Buehner, in your work as a clinician and as an autism parent, what worries do parents most often carry about their other children? What are they telling you, and what do they kind of rarely say out loud, or what are they holding back on?
I think that there's a sense of fear, just like Dr. BK said a second ago, just like every parent has about every child, neurodivergent or otherwise, you worry that you're going to do something to screw up your child long term. Like my behaviors, my actions, our interactions right now are going to have lasting negative impacts. So I think the idea that we have perhaps create dynamics or situations or habits that may impact our child long term in a negative way. That's one of the things that all parents have, but particularly in families where autism is a part of the picture, you worry, am I putting too much in them? Are they perceiving me as treating them unfairly or not giving enough? Do they feel unloved relative to the experience that they think that their sibling is having? So you worry that there may be some resentment that's happening. You worry that you may be positioning one to feel like they're the easy one versus the one that's more challenging, requiring more care. So you just worry that there is some perceived disparity, and whether it's true or not, you worry that you're going to do something that is going to create a long lifetime of resentment. So it's just that concern of, is what I'm doing right now having a lasting impact?
Yeah, that's helpful. Um, Dr. BK, you mentioned earlier that there's this discrepancy between maybe the way parents perceive the relationship and what the kids themselves are reporting. if your kid, if the sibling is saying they're fine or kind of not giving you a lot of information, but you might have some sense that something more is going on, what are some things you can look out for that siblings might be minimizing their own feelings? Or if it's sort of your own anxiety as a parent maybe taking over and you're kind of putting on something that might not be there.
Right. And I think that goes hand in hand with this tendency for siblings to maybe fall into a caregiver role, is maybe a tendency to minimize or internalize what's going on with them, for the sake of family cohesiveness and helping, especially when there's an understanding that there might be a sibling that requires more support or more parental resources. And so I think it's a really important balance to kind of look for signs and open the lines of communication as much as possible to kind of make sure that as much as possible everyone's on the same page. And so, but there's certainly some signs that siblings might be minimizing their own feelings or experiencing internalizing symptoms that parents don't know about, like really increased levels of anxiety or increased mood or depression concerns. And, I think it's understandable for there to be this tendency for kids to mask some of those symptoms for the sake of the family. But there's also a lot of ways that those tend to come out and make themselves known, even if they maybe aren't expressed very clearly or hit you over the head. And so signs that you may want to look for are most importantly, any kind of changes from baseline, right? So if you're seeing things change for that and you're not exactly sure what's going on and the child isn't expressing anything, there may be some signs that there's more emotionally going on. And so we're looking for things like physical symptoms, complaints of headache, stomach ache, appetite changes, panic or restlessness, sleep disturbances, things like that that kind of signal a change in the body that may be going along with kind of changes in their lived experiences or their anxiety. Mood changes, like kids just not acting themselves, irritability, anger, the opposite, kind of flat affect, not expressing a lot, any kind of thing like this doesn't seem right. This isn't quite my kid. Maybe increased isolation or seclusion, like wanting to be by themselves, wanting to kind of spend time away from the family. I also often see kids experiencing somewhat repetitive behaviors, and I mean that in a different way than when we're talking about autism, in that they might be engaging in kind of stress release behaviors. So I hear a lot of pulling hair, picking nails, picking skin, things like he doesn't tell me he's anxious, but he pulled a patch of his hair out, or she hasn't told me that she's upset. But she's all of a sudden she's scratching all the time. And so things like that might seem like fidgets, tics, things that are becoming, somewhat problematic. You also a lot of times will see increased anxiety about other things, unrelated, general, or atypical stressors. Like all of a sudden she's really anxious about general things, getting places on time, family routines, things like that, where it might be a sign that the anxiety is just kind of going somewhere else and kind of building up. And something that I've actually seen a lot is anxiety about family separation or family safety in a way that might reflect increased understanding of what if something happens to my sibling? Who's responsible if something happens to my sibling or my parent? And so, all of this, particularly paired with not wanting to talk. Again, saying that they're fine, not wanting to talk about things, especially if any of this represents a change from baseline or is paired with kind of any other signs.
Yeah, I think that makes a lot of sense. One of the things that I think about sometimes is parents don't always have the tools or can be scared to ask about those kind of things that you're talking about.
Right.
Dr. Buehner, for parents who are worried about that or worried about if I ask about these things, I'm opening a can of worms, how can they invite siblings to share their feelings in a way that feels safe and manageable?
That's a great question. So I think, again, to normalize things in every family, you worry that, is this kind of change? What's that about? You know what I mean? Are they stressed about this? Like all these ways that we perceive our child as seeming a little off, and then all the, projections we might make, worries we might have. The ability to say, okay, so I need to open up the line of dialogue and I need to do it in a way that my child doesn't feel ambushed and they don't feel like they're going to get in trouble for what they say. So it can be easy. Let's say, for example, if your child with autism has had an outburst or there's been a bout of aggressiveness or something like that, it can be easy to just kind of all we want to do is survive this moment, go back to our balanced stasis and, just be okay. But sometimes there's a lot of angst and a lot of big feelings for all kids involved after one of those moments. And when everybody's had a chance to kind of establish safety and get back into their rhythm, in a few minutes, in a few hours, to be able to check in with your child and say, like, what was that like for you? You know what I mean? I know that was scary, or I know that was a lot to have to go through. And we're not assigning the words to them. We're not telling them what their feelings are, but can we talk about things? I want to hear how you're feeling about it. You know what I mean? And to do that in a way where you're not solving the entire problem, you're checking in with how they're doing right now. It's really validating as a human being, but certainly as a child, to have someone who's safe, one of your safe people say, I want to hear where your heart is at. I want to hear how you're feeling, and to let them know they're safe to share with you whatever they've got. I want to know how you're feeling about that. And then to listen to them, and we're not correcting the record, and we're not minimizing their concerns or just get over it. We're not doing any of that stuff. We're letting them have their full bout of going through the whole thing, and they were able to respond to them. I'm glad you told me. I'm glad you told me. I'm probably going to bug you every so often about this kind of stuff because I really care about what it's like for you. So we're not solving the whole thing at once. We're not biting off the whole communication issue at once, but we are definitely opening the dialogue in a very intentional way to give them full space, open-ended questions, and then letting them know that you appreciate their trust.
That's super helpful. I think one thing that I struggle with sometimes is, I've got two kids and like the world is crazy and we've got all these appointments and we've got, activities for everybody, and two parents who are working and navigating those schedules. Dr. BK, can you talk a little bit about the importance of individual attention for siblings and kind of navigating those challenges in busy families? How do we make sure everybody feels seen, like their needs are getting, met and cherished and really loved?
Absolutely. And this is something that's so important in families where siblings may tend to take on a more caregiving role or have more responsibility, because having individual time, one-on-one time with parents is something that really allows them to break out of that role for a little bit. And really, by the nature of their disability, the siblings with ASD generally require more time intensive support. So this is, talking about interventions, school meetings, even just increased need for parental monitoring at home, or kind of adapting to things that are difficult for them in a way that, of course, divides parents' attention and of course becomes noticeable to siblings over time. And one-on-one time is something that can really help to counteract that, to kind of not only have a break, but to also have a moment of this time's about you, you're seen, you're heard. And I think something that's important to note is that one-on-one time does not have to be this elaborate, extremely time-consuming thing. It really doesn't take much for a child to feel that they got that attention or that they got the time from their parents. And so prioritizing that, in a way that can even happen daily is something that is can go a really long way in terms of making kids feel cherished and feel seen. And something that can be really helpful is including interests that are specific to the child in any kind of one-on-one time. And I'm not saying you have to, bring them to a basketball game. It's, what's something that's interesting. It might be talking about a basketball game. It might be sharing a food that this child specifically likes that maybe the other child doesn't, so they don't get as much. It might be watching a television show that's, just for this parent and this sibling to spend that time together. It might be getting out of the house. That might just be kind of going for a walk or kind of running to the store, or just kind of allowing them to kind of have that space to do something that's more individual to them can really go a long way, as well as fostering interests or activities that are special for just that child, especially if it's something that might not be possible with the sibling with ASD, if there might be restrictions on things they like to do, things they'll be flexible around, things they'll eat, things they'll watch. It might be okay, we're going to make sure we're prioritizing time for the things that are important to you too, because a lot of times the sibling needs to be more flexible. And I think this shows them, okay, we're also going to make sure that we're cherishing you, seeing you, understanding what's important for you too.
Yeah, I like that frame a lot. Dr. Buehner, can you talk a little bit about, the parents that you work with clinically or in your own experience? How do you carve out that realistic one-on-one time without adding pressure or guilt to yourself as a parent to try and get that done?
I think Dr. BK said it brilliantly, you know what I mean? So to not think of it as taking on, I've got to schedule something and it's got to be a really big deal. And uh, I think being able to say, like, this is the time I'm going to go ask them to play gin rummy. I'm going to ask them to help me make a vinaigrette, do something silly in the kitchen. You know what I mean? Another thing I like to do, and this is again for all families, not just families on the autism journey, is be explicit about it. Like, I like spending time with you. I like having this one-on-one time with you, being reflective about it and saying, this is important to me. I like being with you. You know what I mean? So we are not, cast players, just around this one child, but literally my relationship with you. I really enjoy this time to be explicit about that. Again, all human beings like feeling appreciated, sought out, and seen and considered. So imagining that you want your child to know that this time, this is special to you. We don't have to overdo it. I mean, we're all dealing with kids, you know what I mean? But the idea of saying, I really like this. Can we do this again tomorrow? Or can you always be my, kid who makes the vinaigrette? Like, I really like it when you're in here with me, mixing stuff up like it's a chemistry experiment. It's really fun for me. And just going out of your way to make moments, little moments, special. It doesn't have to be elaborate. Like she said, it can be little special moments that you decide to carve out and create. Kids really like being sought out for attention, being sought out for checking in. When you enter a room with all of your kids, to ask what's going on, what's the funniest thing you saw on YouTube today? Do you want to help me out with this? How was your day? Like, just seeking a child out, it makes a real impact.
I think these are great points. One thing that can happen in these dynamics is that siblings are really attentive to what's happening with the other kids in the house and notice those differences in attention and expectations. Dr. BK, can you talk about how children make sense of what seems or might seem unfair? Why does that matter? That can feel pretty fraught for parents, and figuring out how to acknowledge that or navigate that can be difficult.
Definitely. And again, want to make sure that I highlight that this is common in all sibling relationships, right? Where there's going to be dynamics of feeling that something is unfair. If one is older and one is younger, if one gets to do something and one doesn't, there's going to be navigating these feelings of hurt feelings and feeling like things aren't equal. And this can be especially challenging in sibling relationships where there are different standards and different expectations by nature of the child's disability. And that's exactly it. Children will feel that situations are unfair if they see differences in parents' expectations or reactions. And I think it's important to validate that that is often the reality, right? Like the reality is that there are often going to be differences in expectations that lead to valid feelings of unfairness, which I think is kind of at the core of what I want to say is that yes, we can't avoid feeling like things are unfair in these dynamics because there are going to be situations where things are unfair and that's a valid feeling for them to have. And so I think one of the most important things is validation of those feelings of things being imbalanced. I know this feels unfair. I understand that you're frustrated. It's okay for you to feel frustrated about that in a way that helps the child kind of feel validated and reflected in that moment. Avoiding things like you should know better, he doesn't know any better, she doesn't know any better, because that's, language that really highlights differences in expectations. And to be honest, siblings know, they know that there's reasons that their sibling doesn't know better or that there are different expectations. They don't kind of need to be reminded of that. It's still valid for them to feel like, yeah, sometimes it's unfair. And I think something that can help to counteract that a lot is psychoeducation about the disability and kind of having siblings be involved in open, clear communication about the child's needs and what's hard for them and what makes more sense for them and what's going to help. Because it's especially important in autism because autism can mean so many different things, right? And siblings' needs will look so different from family to family. So I think being really intentional around helping siblings understand kind of what their siblings' needs are can kind of both help them to cope with things that are unfair sometimes while still validating that yes, it's frustrating that sometimes things are going to feel unfair. And something that can help to counteract that as well as much as possible having some family rules that can be consistent for everyone. This can be something really minor, something really small, but just seeing that there are situations where everybody in the family is expected to follow a same rule or follow a same standard or follow a same schedule can help to kind of you know, help things to feel more fair in a way that doesn't dismiss the child's feelings.
Yeah, that's great. Dr. Buehner, any wording or verbiage that you've come up with in your clinical experience to communicate these ideas around fairness that can avoid some of the pitfalls that Dr. BK is talking about?
Well, we've used the word validation several times today. So I think, again, the ability to, as much as we want to, again, return to a balance, everybody got through that rough time, or we had a rough day yesterday, we're back on track today. But to be able to validate the siblings' experience of kind of how things are going or how they're feeling about things, to be able to open that up. And, sometimes you're going to get messages of it's not fair, or I hate it that, or how come he gets to some of that kind of stuff, and the ability for us to say, you're right. Right, you have every right to be frustrated by that. It's completely understandable how you feel. Some of this, can be explained with, as Dr. BK mentioned, educating a little bit. I have an example. One of my children asked, "Why do you let him ask the same question 8 million times?" You know what I mean? Because my child on the spectrum tends to do that, and just explaining that I know it's irritating sometimes to you, perhaps, but it also is a way for him to establish safety. Like, for if I give him the same answer every single time, it's a way for him to know, like, this room is safe, everything is as it should be, and yes, the Titanic did sink. So being able to provide those, like, in real time moments of understanding. And again, sometimes the balance is just validating their experience of, I get why you feel that way. I'm glad you said something about it. I'm going to work on it. You know what I mean? You have every right to feel that way. The experience of the person to whom you're complaining or giving your upset and vulnerability, them saying, I see you. I see what your feelings are. I understand them. Here's how we can work on it. Here's how we can work through it, is really powerful. And it keeps us from that child feeling numb, not knowing what to do with their distress. It lets them know my feelings matter.
That's great. I think I'd like to maybe get a little deeper into this idea of caretaking and boundaries that we've touched on in a couple other points. You've said several times, Dr. BK, that siblings kind of step into this helper role, and that can be fraught sometimes. And sometimes there's, aggression from the autistic sibling in that, and sometimes, other dynamics might emerge. Can you talk about just why it's important for parents to pay attention to that and what kinds of things they may need to look for in terms of places to intervene as parents?
Yeah, this is somewhere where we tend to see differences in parent and child report, maybe in a more problematic direction, where a lot of times the evidence is showing us that children may not be telling their parents about aggression directed towards them, and that parents then may not realize the severity or frequency of aggressive acts that are happening in a sibling relationship. And this is kind of tied into the tendency for kids to be take on more of a caregiver role because they may feel like they need to minimize these experiences as part of their helper role, or take it or deal with it on their own as part of their helper role to kind of help their parents out. And we've seen high levels of aggression and stress related to aggression being reported across the research. So aggressive behavior has been reported as the most common problem in that's reported by siblings. So if you ask siblings kind of what are some of the biggest stressors in your relationship with your sibling, aggressive behavior is oftentimes at the top of the list, and with high numbers, some studies finding 84% of siblings reporting aggression as a concern in their dynamic with their sibling. And when we look at coping strategies, we also see that a lot of times there are some maladaptive coping strategies for dealing with aggression. One of the most common being anger. So this is somewhere where it can kind of build up resentment, can kind of, plague the sibling relationship if this is something that siblings have to deal with and are not having support around, or being taught how to cope with, and, not even cope with, but stop, kind of have someone to kind of help keep them safe. And it's a problem that's often underaddressed in support for siblings. So, kind of looking at sibling specific intervention, while a lot of them are focused on conflict, a lot of them are not specifically providing psychoed around what to do if there is aggression, who to seek out, how to kind of find that safety. And of course, in a way that can be problematic and lead to children feeling unsafe at home, or feeling like they have to manage difficult behaviors on their own in a way that can become overwhelming or can become draining. And so it's really important to kind of open up communication and pay attention to this dynamic to make sure we're creating safe family dynamic at home. And that siblings understand that this is not something that kind of falls under the category of something that they have to bend around or something that just kind of happens. It's something that we want to make sure that we're supporting you in.
Yeah, got that. Dr. Buehner, what are some strategies to ensure that a sibling is not taking on too much responsibility? How can parents sort of gently reset roles without making the sibling feel unappreciated for the help that they're trying to give?
Well, I think one thing to keep in mind is where on the kind of obligation spectrum they feel that you feel that they are. So is this something where they feel like they have to take responsibility for the other child's behavior or their mistakes or their messes? You know what I mean? How could you let them do this kind of stuff? So we want to avoid language that's blaming or targeting or finger pointing about the ramifications of the child with autism's behaviors. We also want to look at kind of think of appreciating your child's helpfulness versus making them responsible for the other's behavior. So the idea of thanks for helping, or thanks for setting the table, or I appreciate that, or that means a lot to me. You know what I mean? That sure does make life easier. But it's not an obligation where if they don't do it, or certainly if their sibling gets into messes, mistakes, outbursts, etc., we're not putting the blame on them because they're just a child living here on the planet for the first time too. So we want to make sure we treat them like a child. So appreciating helpfulness versus obligation and responsibility is kind of one way to think about it. And appreciating helpfulness it goes a long way. So thank you for setting the table. Like just like we do in any household, your contributions matter so much. You know what I mean? And I think too, being careful with moments where you notice them taking on too much without you asking them to do that, feeling overprotective. A child who says you need to tell them blankety blank, being able to say like that's my responsibility. I'm going to handle that. Like this is my thing. I will take care of this. To keep them from feeling like they've got to, create justice or do any of the parenting themselves to again understand they're trying to make the situation better. They're trying to assert some control, and it's admirable. However, you just get to be a kid. Let me handle this in whatever kind of way feels right to you to say that. You don't necessarily, our viewers here don't need us to put a script in their hands necessarily, but the idea of saying, I'll take care of this. This is my thing to handle. You know what I mean? I appreciate how much you care about it, but let mom handle this. Some version of that may be really useful to kind of put in your toolbox.
Yeah, and I think it may be helpful to help folks get an idea of what like healthy sibling involvement looks like. So maybe Dr. BK, you could share a little bit about sort of how you think about that, what that healthy sibling dynamic looks like.
Absolutely. And to echo what Dr. Buehner said, kids like to be helpful. They like to be involved and to kind of be appreciated and to be sought out to help with things. And so there's certainly healthy ways for siblings to be part of routines. And a lot of times that's going to include being praised, receiving positive reinforcement for helping or for setting a good example in a way that doesn't feel like a responsibility, an expectation, a burden, but feels like something that they're a cherished part of the family for, and something that they're a cherished person because they're helpful and they have all these skills. And I think another part of healthy involvement includes being involved in conversations about their siblings' needs in a really open and positive way, in a way that doesn't necessarily create fear, doesn't create anxiety, or doesn't create an environment where they feel like hard things are minimized and that they don't have the opportunity to kind of talk about things that are going on, and avoiding some of the more unhealthy dynamics that we've talked about. Number one, being the recipient of aggression. Any kind of physical or verbal aggression is the number one thing we want to make sure we're looking out for, that can become very overwhelming and can become a drain. And then, just watching a dynamic that turns into too much flexibility on the part of the sibling, and that it's more bending to the sibling's wants than shared enjoyment in the dynamic, or becomes more caretaking, more babysitting in a way that they're taking on responsibilities that they don't need to, and in a way that kind of forgoes their individual wants or needs. And so just kind of being mindful of that balance while also not being afraid to have siblings involved in a way that's really healthy and helpful.
Yeah, we've been talking about sort of the younger end of the kid spectrum, and I wonder as we look towards, kids who are grown up or heading into their teen years or adults, as siblings grow up, how can the early family experiences that we're talking about shape who they become as teens and adults? What do you think about as sort of the best possible scenario of raising healthy kids together, neurodivergent or otherwise?
Yeah, the sibling relationship is the longest lasting familial relationship that there is. And so creating a good foundation in any sibling relationship really sets children up for a lifetime of support, fulfillment, positive reinforcement in, safety in that relationship. And there are many positive long-term outcomes to growing up with a sibling with ASD. And a lot of these, might look like increased acceptance, unique experiences for the family, resilience when things are challenging, family cohesiveness, the kind of this ability for the family to come together and understand how to support each other, a lot of humor, it's a lot of, fun, funny, unique experiences, as well as a way to kind of practice advocacy skills, standing up for yourself, standing up for others in a way that's really important. And so the most important thing is just kind of avoiding patterns of suppressing needs or internalizing negative experiences and kind of making sure that we're fostering clear and open communication and support, as particularly if there's a situation where a sibling will eventually be a caretaker. We
Mm.
want to make sure that we're being very clear and thoughtful and intentional about kind of what that's going to look like, and having open communication about that, because that's something that could be a unique stressor. Really, with the best possible scenario, not being avoiding conflict or stress, because it's not realistic. And you're not going to have that in any sibling dynamic where you can avoid conflict or stress and kind of take those negative experiences away. But providing children with the coping skills that they need to manage unique stressors and thrive so that siblings can really flourish and create a lifelong bond, whatever that looks like for them.
Dr. Buehner, as you think about that kind of identity process and growing up in families, what can parents do to make sure their non-autistic children are known and valued for who they are, not just for being understanding or easy or accommodating?
Yeah, and so we'll say it again, just like in any family, you want everybody to feel like they can absolutely thrive at being just themselves. And so the idea of appreciating who they are and their accomplishments, not as caregiver of or not so responsible, all of the ways that we might shine a light on, again, that responsibility piece, but instead to talk about their big hearts, talk about all the good things that they do, talk about their growth, their interests, ask them questions and support that growth, you know what I mean? So that they develop that identity beyond just sibling of or child of. So just like in any family, we want each of our kids to grow up feeling like they can be exactly who they want to be. That's what we're striving for here. So today we've talked about one-on-one time. We've talked about, I think I've kind of danced around it a little bit, but the social response you get that is from the listener when you share your distress after a scary moment, after an upsetting moment, when you've got any big feeling, the response that you get from that listener where they say, I'm so glad you told me. It's understandable that you feel that way. I'm a psychologist. I get paid for having, an open, caring response to somebody, but the world is a better place when you've got people in your life who listen to where your heart is, listen to what's on your mind, and understand it and help you with strategies for what's next to feel better. That's just a great way to be in this world, and it gives us healthier children when we can be those kind of vessels for all of that emotion and feeling. So, to your question, Dr. Russ, I think it's really helpful for us to think of ways to appreciate who the child is, each child is, their strengths, autistic or otherwise, you know what I mean? So, who they're becoming, and really talking about what a delight it is to be the parent of them, you know what I mean? And to watch that growth and to encourage that growth and ask, how you can support that growth. That's the experience of every parent who wants to do it right. And it's no different in cases with autism.
That's really great. I like that view. Um, as we sort of think about coming to a close of the formal portion, and then we'll have some time for Q&A for folks in the audience. Dr. BK, if parents take just, one idea from today, what would you most want them to remember about supporting siblings, or what's the most sort of helpful thing you've come up with in your research that parents should think about?
The number one thing that I try to communicate to parents, both consistent with the research and kind of, just with my clients, is that siblings generally perceive the sibling relationship with their sibling with ASD as much more similar to typical sibling relationship than parents do. And I think that's a really important point to emphasize to help reassure parents and make them feel like they don't have to have this really unique and special set of skills to kind of help navigate this relationship, and that we can provide important supports for helping these kids to thrive while also realizing that there are many aspects of the sibling relationship that these kids are really enjoying.
Mhm. Uh, Question in the chat about some older siblings. What can a parent do to support the relationship between two siblings who are 25 and 29?
Well, I think, if you don't mind, Dr. BK, if I jump in, I think one of the things that we know about individuals with autism is oftentimes a lot of the sensory issues that they might have, a lot of issues that they have with social interactions, sometimes feeling like the environment is safe, the person you are talking with is safe, that you can be who you are without needing to mask or, sort of be terrified. The ability to establish comfort and predictability for individuals with autism sometimes is really helpful to allowing them to feel safe to socialize, safe to interact, safe to be who they are. And so, in a situation, I don't know the 25 and 29-year-olds to whom we're referring here, but the idea of what would it take for everybody's needs to be met in conversations, dynamics, and interactions? Of course, we've been around for a while at that point, but we want to think wherever the deficit is in terms of, environmental stimulation and things like that. How can we set the scene for it to be as relaxed and calm as possible? So they're not managing their sibling, they're not apologetic. Neither party needs to feel like they need to bring something other than just who they are. So for autistic individuals, and if you know one autistic individual, you know precisely one autistic individual, but how can I make this conversation, this interaction, this holiday, I know it's a pressing concern for a lot of families, as relaxed and predictable as possible. So what are the sensory kind of inputs that I can help impact that might make it feel more so? And how can I make it so that this is as low stakes and easy for everyone involved?
Yeah, I think that's great. Um, and again, as we can move towards wrapping up, Dr. Buehner, for parents who are feeling, guilty, stretched thin, worried they're getting it wrong, stressed about the holidays and sort of screwing things up over the next couple of weeks, what would you want them to hear as we wrap up today?
Well, first of all, you're here. You took the time to watch this or seek this video out or be with us today. And I think that that indicates that you've got a level of caring and wanting to get it right that you can feel proud of it. That's a big part of the battle right there. I think that as parents on the autism journey, we are naturally going to feel like we don't always know exactly what to do. This isn't programmed the way that society programs it for a lot of families. So a lot of it is just getting through the day, as I mentioned. But I feel like when you get a little bit of information like what folks are hopefully getting today about how to be a more effective communicator and make sure you're a great listener to the best of your ability, the idea of going home tonight and saying, I've been thinking about something about our conversation the other day or how things went down on Tuesday or what it must be like for you. To say I was thinking about you today or I was thinking about it, to let that child know that you consider them and that you think about them and you think about their well-being, that they occur to you, not in the context of being so-and-so's brother or sister, but literally your well-being really matters to me and it was on my mind today. And so I was wondering if, and kind of just again opening to that might be how you feel about the thing that happened the other day. That might be, can we play some cards later? That might be, could we start a thing where you always go with me to Kroger just so we get some time in the car? But I was thinking about you is a great way to kind of open up when you're about to make a slight change. Kids can get onto that and find it kind of sus, but to indicate like that they matter to you, that they're considered by you, their well-being outside of the context of being a sibling matters to you, can be really useful. So in terms of what to do with all of this, I think opening the floor that way and letting them know how much you consider them and how much they matter can go a long way.
I think that's really great. Any other questions in the chat before we close up for today? I really appreciate you all being here and sharing all this information. This is incredibly helpful and exactly what we're hoping to do with these workshops is, bring psychological science to the public and talk about how people can use that to improve their daily lives, improve their relationships, improve their parenting. So just really appreciate you all being here today.
For our FEET families who are watching today, Families for Effective Autism Treatment, I know that you know Melanie and myself, we really care about hearing from you. If there are ongoing concerns that you have about the mental health in your families and how to enhance or bring peace or make things just a little bit easier, even if it feels kind of niche or nuanced just to your family, feel free to share those topics and worries with us because we are happy to put together the right experts to try to answer some of your questions and make life better. It really can be better together.
And we'll have this video posted in early January for folks who weren't able to make it today, so you all can share it with folks in your networks then.
One resource that I just wanted to share with everyone that I've found really helpful with my families is just this very short book. It's called Views from Our Shoes, and it's just a collection of short essays from siblings of kids with ASD. It's, short transcribed summaries from 4-year-olds all the way up through teenage years, kind of what experiences are like. So maybe we can, oh, great, put it in the chat right there. Something, an easy read can be really helpful for kind of opening conversation there.
That's wonderful. Great. And thanks for Dr. BK for being with us today. Thanks to Dr. Buehner.
Happy to.
Really appreciate all the information and hope everyone gets some rest and recharge in the next couple of weeks. Thanks,
Happy
everybody.
holidays. Thank you.
Bye, everyone.